This is Dr. Garth Rosenberg, a capital vein and laser. I thought I'd go over a little bit about the differences and treatment options for varicose veins. Patients are confronted with a lot of different advertisements pushed towards them and a lot of commentary on Google or from friends who have had various things done about their varicose veins. And I thought I'd help provide some clarity as to various options that are available. Varicose veins are generally caused by weak valves in the leg veins, and instead of the blood traveling up the leg as it should, with gravity pushing downwards, blood is pooling in reverse fashion, causing excess pressure in the veins of the leg, and then the surface veins start bulging and protruding, causing varicose veins. Symptoms we commonly see are heaviness, aching, tiredness, fatigue, swelling, and even restless legs are seen with the varicose veins. When we evaluate a patient, first we'll do a vascular ultrasound, and this will look at the image of the veins and show us which veins are functioning normally and where the little valves are not working well and blood's going in the wrong direction, causing the pooling of the blood in the leg. Most times this is caused by the saphenous vein, which runs linearly up the leg from the ankle to the groin, and commonly the section of the vein between the groin and the knee is where the valves don't work very well, and that is the source of varicose veins. It used to be that patients would have vein stripping, which was a hospital procedure done under general anesthesia, but this was quite invasive, painful, didn't work as well as current methods do, and has fallen out of favor. Now we do office-based vein procedures, the most common being the closure procedure. In this procedure, which takes about 15 minutes under local anesthetic, we first numb the inside of the leg and place a small IV in the vein. Through the vein, we slide a tiny wire up the vein towards the groin, which you won't feel. There's no nerve endings in the vein. We'll give a little extra local anesthetic and then withdraw the wire, which is a heated tip, and that heated tip causes the veins to shrink, seal, and close down, preventing the reflux or the source of the pooling of the blood. So the closure procedure is very commonly done, very successful. We've done over 10,000 in our practice and is an insurance-covered event. There's a new procedure called Venous Seal, which uses a glue which we insert into the vein, and it uses slightly fewer local anesthetic needle sticks, and that glue will close the vein, again preventing the reflux or insufficiency in the vein. You should know that most insurance companies do not cover Venous Seal as an approved treatment because it was just FDA approved and the data is rather sparse. Another treatment we can use is called Claravane, and with Claravane, it's a form of sclerotherapy. Again, we numb the vein around the knee level, insert a small wire in the vein, and then we inject a special medication into the vein, which is a sclerotherapy, and this is assisted by a small wire that spins inside the vein, causing damage to the inside wall of the vein, making that sclerotherapy a little bit more effective. The procedure is relatively painless, again, takes about 15 minutes. Some insurance companies do not cover it because the data is not as well presented as with the closure procedure. The results with Claravane are pretty good, but not quite to the level of the closure procedure. Varithena is another form of sclerotherapy using foam, where we can inject this medication into the vein, again causing the vein to close. The results are not quite as durable, and we seem to have to intervene more frequently on patients who have venous seal. Again, insurance companies are not commonly covering this procedure. I think bottom line is if you have saphenous vein reflux, the best treatment, the most durable, successful, painless, and successful is the closure procedure, which again takes about 15 minutes in the office. There's no stitches. You'll be able to walk immediately, drive yourself, return to normal activities the same day, and it's a very effective treatment. Sometimes lower leg veins remain after the saphenous vein is closed, and if they do and they're symptomatic, we do a small microphlebectomy procedure, which means, again, under local anesthetic, we'll numb the area over the veins, use a few small needle sticks, and extract the vein, which you won't feel, but we'll be able to extract the vein and remove it completely. You don't need these veins, they're not functioning well. Most commonly, there are no stitches with that. We'll wrap you with an ACE bandage. You'll wear a support hose for a few days, but again, you can return to normal activities most times the same day. If you have questions or concerns or to have issues you'd like to discuss. Both Dr. McNeil and I are very well-trained vascular surgeons with over 30 years experience treating venous disease. We continue to teach nationally and internationally, and our staff is well equipped to help you find the answers to your particular problems.